Hey Vault Squad, welcome back to the Pharmacology Vault, where complex concepts become crystal clear. Today, we're diving into a key drug class that every pharmacology student needs to know: cholinergic drugs. These are the meds that tap into the power of acetylcholine, one of the most versatile neurotransmitters in our nervous system. From brain function to bowel movement, these drugs influence a wide range of physiological processes. So let's break it all down, slide by slide. Grab your notes. Let's start cracking this vault. So what exactly are cholinergic drugs? They're a class of medications that either mimic acetylcholine, ACH, or modify its availability or action. That's why they're also called cholinomimetic agents, because they mimic ACH. Parasympathomimetic agents, because they enhance parasympathetic activity. Their main targets? Two types of receptors: muscarinic receptors, found in organs like the heart, GI tract, eyes. Nicotinic receptors, found at neuromuscular junctions and autonomic ganglia. These drugs act centrally, affecting memory and cognition, or peripherally, affecting muscles and secretions. These drugs work on two major systems. In the CNS, they affect memory, alertness, and coordination. Think of Alzheimer's treatment here. In the PNS, they regulate involuntary functions, like heart rate, digestion, urination, and neuromuscular activity. That's why their clinical applications range from brain disorders to bladder dysfunctions. Let's talk classification. Cholinergic drugs are broadly divided into three categories based on how they work. Cholinergic agonists. These directly stimulate cholinergic receptors. Cholinesterase inhibitors. These indirectly enhance ACH levels by blocking its breakdown. Cholinergic antagonists. These block ACH receptors. We won't go into detail today, but they'll get their own episode soon. Let's zoom in on cholinergic agonists, also called direct-acting cholinomimetics. These drugs mimic acetylcholine and bind directly to muscarinic or nicotinic receptors. They're divided into two groups: choline esters, synthetic or natural ACH-like compounds. Examples: acetylcholine, too rapidly broken down for use. Methacholine, used in asthma diagnosis. Carbachol, eye drops for glaucoma. Bethanechol, used for urinary retention. Alkaloids, plant-derived compounds. Examples: Pilocarpine, for glaucoma and dry mouth. Muscarine, from mushrooms. Acetylcholine, from areca nut. These drugs mostly act on muscarinic receptors, especially in smooth muscle and glands. Anticholinesterases are drugs that inhibit the enzyme acetylcholinesterase, ACH, the enzyme responsible for breaking down acetylcholine, ACH, at synapses. By blocking this enzyme, these agents increase the concentration and duration of ACH activity at neuromuscular junctions and synapses, enhancing cholinergic transmission. They're divided into two major categories based on how long and strongly they bind to ACH. Reversible anticholinesterases. These drugs form temporary bonds with ACH and are widely used in therapy. They can be broken down and removed by the body over time. Carbamates, longer acting, commonly used in clinical settings. Physostigmine, crosses the blood-brain barrier, used in anticholinergic toxicity. Neostigmine, used in myasthenia gravis and reversal of non-depolarizing neuromuscular blockers. Pyridostigmine, longer-acting alternative for myasthenia gravis. Rivastigmine, used for Alzheimer's disease, CNS selective. Non-carbamates, shorter-acting or centrally acting agents. Edrophonium, very short-acting, used in the tensilon test to diagnose myasthenia gravis. Donepezil, used in Alzheimer's disease to enhance cognitive function. Galantamine, also used for Alzheimer's, has nicotinic receptor modulating effects too. Irreversible anticholinesterases. These compounds bind permanently to ACH, rendering the enzyme inactive for long durations. Some are used therapeutically, but most are potent toxins, pesticides or nerve agents. Carbamates, used as insecticides. Carbaryl, marketed as Sevin. Propoxur, marketed as Bagan. Organophosphates, used in therapy and research. Diflos, DFP, a potent agent, mainly for research. Ecothiophyte, the only organophosphate used therapeutically, in long-term treatment of glaucoma. Used as insecticides. Malathion, diazinon, TIC20, used as chemical warfare nerve agents. Tabun, sarin, soman. Note: Irreversible inhibitors can cause cholinergic crisis with excessive salivation, muscle twitching, convulsions, and potentially fatal respiratory paralysis. Antidotes like atropine and pralidoxime, 2-PAM, are life-saving in these cases. Postoperative ileus and urinary retention. When a patient can't pee or poop after surgery, enter Bethanechol, a muscarinic agonist, part of the choline ester group. It stimulates the smooth muscle in the bladder and GI tract to restore function. Simple, direct, effective. In glaucoma, where fluid builds up in the eye and increases pressure, we use drugs that either mimic acetylcholine or boost its levels. Key players include Pilocarpine, carbachol, physostigmine, and ecothiopate. These work by constricting the pupil, which opens up the drainage pathway and lowers intraocular pressure. Here, muscarinic agonists like pilocarpine and cevimeline are your best friends. They stimulate salivary glands and help restore moisture, especially helpful in autoimmune conditions. To test for asthma, we use methacholine, a choline ester. It provokes a mild bronchoconstriction, and if the patient reacts too strongly, that's a positive result in the methacholine challenge test. To diagnose myasthenia gravis, we use edrophonium, a short-acting reversible anticholinesterase. It temporarily improves muscle strength. If the weakness vanishes after injection, that's a diagnostic clue. In glaucoma, where fluid builds up in the eye and increases pressure, we use drugs that either mimic acetylcholine or boost its levels. Key players include pilocarpine, carbachol, physostigmine, and ecothiopate. These work by constricting the pupil, which opens up the drainage pathway and lowers intraocular pressure. Here, muscarinic agonists like pilocarpine and cevimeline are your best friends. They stimulate salivary glands and help restore moisture, especially helpful in autoimmune conditions. To test for asthma, we use methacholine, a choline ester. It provokes a mild bronchoconstriction, and if the patient reacts too strongly, that's a positive result in the methacholine challenge test. To diagnose myasthenia gravis, we use edrophonium, a short-acting reversible anticholinesterase. It temporarily improves muscle strength. If the weakness vanishes after injection, that's a diagnostic clue. For long-term treatment, we use neostigmine, pyridostigmine, and ambinonium, all reversible anticholinesterases. They boost acetylcholine levels at neuromuscular junctions to improve voluntary muscle strength. In Alzheimer's, we target the central nervous system. Drugs like Donepezil, rivastigmine, and galantamine are centrally acting reversible anticholinesterases that enhance memory and cognitive function by increasing acetylcholine in the brain. After surgery, when we need to reverse muscle relaxation, drugs like neostigmine, pyridostigmine, and edrophonium are used to restore movement by boosting ACH at the neuromuscular junction. If someone's taken too much of an anticholinergic like atropine, we use physostigmine, a unique drug that crosses the blood-brain barrier and restores cholinergic tone in both the central and peripheral systems. Ecothiopate, an irreversible anticholinesterase, provides a long-lasting effect to control intraocular pressure. It's powerful, so we use it when other options don't work. And that's a wrap on cholinergic drugs, classification and uses. You've now mastered the key differences between direct agonists and indirect inhibitors, the major drug names, and the logic behind their use. If you found this breakdown useful, smash that like button and subscribe for more smart pharmacology. Next up in the vault, we'll explore cholinergic antagonists, the drugs that block ACH and calm the parasympathetic system. Until then, stay sharp, stay curious, and keep unlocking the secrets of pharmacology.